Just waiting for people to come online. I know everybody's home and dealing with the coronavirus in your home, but we have a lot of attention on the virus, but we still have other health conditions that we still need to take care of, like some people have diabetes, some people have hypertension, some people have more of arthritis, osteoporosis, all those kind of situations still going on, and you've got to service those things while you're at home. I know you can't go to chiropractors at this point right now. At least some of us cannot. Some chiropractors are closed. I know physical therapy, a lot of them are going online, and most of us don't adjust well in terms of going online to do things. But we still got to service some of the problems that we have, posture issues. You've been victims of accidents, all kinds of things that have happened. You still want to keep up with your weight loss. You want to still be able to keep up the body movement because of aches and pains that are basically in your body, whether it's an aging scenario or you actually have like upper cross syndrome and lower cross syndrome, where your body needs to be adjusted and strengthened at the same time. You have a lot of people with scoliosis that still need to have some exercise in there. So just waiting for people to come online. Again, what I want you to do is share this live. I want you to hit the like button as much as you can. I also want you to share as much as you can. We're going to talk about something that's real life. Remember what I'm saying. You're at home. There is a virus that is very, very real out there, and we should be taking care of ourselves. We should be making sure our zinc levels are up. We should be taking vitamin D3. We should take about 50 milligrams of zinc, as a matter of fact. We should make sure we wash our hands for at least 20 seconds. We need to remember to wash our hair, and women can also use dry shampoo. I know you got your braids and things like that. You can do things like that. But we should be really taking care of ourselves, eating better, more fruits and vegetables than we're eating. Remember to eat less sugar because you don't want to suppress your immune system. Sugar, soda, diet soda, all those kind of things will suppress the immune system, and you want your immune system to be as healthy as possible. You don't want to smoke because remember this virus is basically going to be a respiratory illness situation. You want to gargle and keep your throat clear as much as you can, those of us that deal with sinus drainage and all the things that are going on. And so you can do that with warm water and vinegar, warm water and lemon. You can gargle with, but you want to do it with warm water when you're doing it. You want things to go down your throat, not into your lungs, but go into your stomach, so your stomach acids can kind of help neutralize things before it becomes a problem and all this mucus builds up in our lungs, because that's what happens. It's thick mucus in our throats, closes our lungs, and the medications don't, they'll take a long time. By that time, that respiratory situation can really, really get worse. So you want to start taking care of that. And if you feel a tickle in the throat, if you feel sniffles, anything, any symptoms of a cold or flu, you want to start treating it with over-the-counter things as much as you possibly can. But I'll go back and tell you again, about 50 milligrams of zinc. You want to think of your zinc numbers. You want to do D3 vitamin, of course, vitamin C. The research behind that doesn't say that it stops coronavirus. That's not what I'm saying. I'm saying that it boosts your immune system so that you have a greater chance to fight. And I'm also saying that you should gargle with warm water and vinegar or lemon or salt. Kind of keep your throat clear. The mucus and things that builds up in our throat before it gets down. And we start having respiratory problems and breathing problems and things of that nature. You really wanted to start working on those things. I am not giving you a cure for the coronavirus. Although studies show that other strains of coronavirus, flu, cold, and all those other kind of things, they have not survived in heat. And and things of that nature. But this is a different strand. So I'm not telling you that heat kills it, sunlight kills it. I'm not telling you any of those things. And also remember that there are new updates as they're studying this thing, because this is something brand new. This is not a regular strand of the coronavirus. And so there's study coming up with research as people have died, and they're taking time to research what really happened with them and things like that, because some people didn't have pre-existing conditions. However, it could have been a weak immune system. It could have been anything, along with having the coronavirus. They just weren't not strong enough to fight for whatever reason it is. And so I'm not telling you, again, that any of these things kills it, but you do know that you need to take care of yourself. You do understand that as we get this information, how long that virus can live on surfaces and all those sort of kind of things that are going on, and in droplets in the air, and they're saying a lot of things to it. So you want to pay attention to that, update yourself, and be careful. All right, I'm just talking because I really want people to get into the room, but I'm very, very serious about you protecting yourself and taking care of yourself, and knowing how to take care of yourself. Again, take some time and wash your hands with any foaming soap for 20 seconds. Make sure that you're taking D3. You need your zinc levels to come up. You need your immune system as strong as possible. And I really don't understand why y'all are ordering Papa John's, pizzas, and all this other kind of stuff. You know you need to cook. You need to cook, okay? You need to cook. And you need your immune system strong. You need to eat a little more fruits and vegetables. I know it costs, but you're going to have to do that in order for you to survive what is going on. And you're going to need to go to bed. You're going to need to sleep. And y'all are up like consistently, but you need to go to bed and not overeat. So you're going to have to exercise, because a lot of us are overeating. I see people with some ADHD symptoms. I'm telling you that you do. Just like you can't always understand what is going on, you also can't understand what your body is saying. So you just simply overeat. And then, there's symptoms of depression and anxiety. There's all kinds of things that are going on with us. And so we're going to need some help. That's where holistic coaches come in. That's where behavioral health coaching comes in, mental health coaching, and also mental health counseling can come in and help you through the process. You're going to need some help going through the process, so don't forget to reach out. My number should show up on the screen sometime soon, but the number is 240-383-4800. And of course, we're trained in coaching and counseling, and we have some years in both areas as it relates to mental health, behavioral health, as it relates to clinical exercise physiology, exercise therapy, being a clinical herbalist, aromatherapy. All those things are things that we specialize in. If you can use eucalyptus in a diffuser, that's very good too. You want to open things up a little more. But today I want to talk about something that is important, because as I said, there is a virus, but there's also other conditions that are in your body. And one of those conditions that people are dealing with is osteoporosis. So it goes like this, because there are things I think that you don't know that we really should talk about a little more. For instance, your body constantly absorbs bone tissue. And what happens with osteoporosis, the new bone tissue that is going forth cannot keep up with the old bone removal. So you end up with what we call brittle and weak bones. So you got to remember that. Remember that, again, your body constantly absorbs and replaces bone tissue. And remember that with osteoporosis, new bone creation does not keep up with old bone removal. And then your bones become very weak and become very, very brittle. Remember what I'm saying again as it relates to osteoporosis. Osteoporosis does mean that you have weak, brittle bones. But how? It's because your body constantly absorbs and replaces bone tissue. But with osteoporosis, the new bone creation does not keep up with old bone removal. And so therefore your bones become very brittle, and they become weak. So we've got to do things like take in calcium. Before you do that, you want to check your doctor. There's a couple other things that I could want you to do. But again, you need some online help. So you call my number, 240-383-4800. But let me show you a couple of exercises that you can do. So let's go from the top up as it relates to osteoporosis. So using small weights, because what we can do is weight-bearing exercises. Weight-bearing exercises, you can start off here, and you can go here, and then up here. Because remember, that you want to have weight-bearing exercises, and you want to strengthen your arms, you want to strengthen your trapezius muscles, you want to strengthen the muscles that are in your body, also strengthen your bones. I'm going to call Lamore in. Lamore, I'm going to call him in, and he kind of works with patients around here a bit. And so the other one is when you talk about weight-bearing exercises, of course you can use the treadmill. If you're not using the treadmill, then I suggest that you walk from the living room to the kitchen, from the kitchen to the living room, but you need to do some walking to strengthen yourself as it relates to osteoporosis. There's something else that you should be able to do. You need to do some squats. So you can use a chair like this. Now, you don't want to lean in and then get up like this. That's not what you want to do. You don't want to go past your toes. You want to kind of stand straight up. You can come on in a little more. You kind of want to stand straight up. And if you're standing straight up, you can start off using the chair like this, right? You can start off this way of standing straight up. Just stand straight up just like this. You want to practice that. But that also helps you be able to go up the stairs, because a lot of times people with osteoporosis, they can't go upstairs. Eventually, you can start using one arm, right? And get up like this. Now, if you're working out with Lamore, when you come over this side, they can really see you. If you're working out with Lamore, and Amos is behind the camera, if you're working out with those two guys, you won't be using your hands at all. I probably will, give you an opportunity to get it that way. But if you're working with these two guys right here, they're probably going to tell you to do this. They're going to want you to come straight up like this. So Lamore, we were saying too that your suggestion was some of the clients you have is they hold on to the chair.
Yes.
Right? And then you wanted them, let you demonstrate what you wanted them to do. So Lamore is going to demonstrate what he wants you to do as it relates to, go ahead.
Chair exercise and support by the chair, because most people with osteoporosis, they suffer with fearing that they would lose their balance. So, you can hold on to the back of the chair. These are things you can improvise with and slightly come down, but keep your head up and just work slowly. So all you're doing here is just building up your leg strength and your glutes, your hamstrings, and then your quads, okay? Those are exercises that you can do with the chair. You can also take the same chair and lunge forward slightly.
Don't try to go all the way down to the floor, because you may not get up.
Yeah, just a slight. So that you're not putting too much pressure on the quad or too much pressure on the knee. Just a little bit. Right? You do that 5 times on each leg.
And that's another reason why you don't want to lean over when you're getting up.
No.
Because if you lean over when you're getting up, you're putting pressure on your knees. Same thing when you get up out of the chair. People get up out of the chair, say, oh. You're really putting more pressure on the knees. So we try to get you to stand straight up out of the chair as opposed to doing that. But more, I was thinking about something else too. I was looking at a couple of the patients, and because of their balance, it's kind of being able to get them to step side to side.
That's another routine that I normally work with clients that suffer with osteoporosis is stepping forward, stepping backwards, and stepping side to side. So for me, their steps would normally be, as Dr. James just, so I'm piggybacking off of it, would be side step motions. And along with those side step motions, I might even often ask them to squat like that. I would have them to step forward as well as stepping backwards, but being conscious of it, because a lot of people will look behind them before they step backwards with osteoporosis. So you just step back.
And a lot of them doing that because they're afraid. They're afraid of falling. Their balance is off. So what he's going to do is he's going to teach balance as well.
Yeah.
You being able to balance. So again, with both, Amos is here, David is here, Lamar is here. These guys are trained. They know exactly what to do. Lamar, I was talking a little bit about the weights in terms of the upper body.
Okay.
And so he's going to show you again exactly what I'm talking about.
Okay. Building upper body strength. I would normally have a patient or a client that's suffering with osteoporosis to start here. Waist level, raising the weights above the shoulder, and up above the head. Motions back down, dropping back down, back up to the waist, back up to the shoulders, above the head. And when you come back down, I come into a squat. And back up. Up. Squat.
Now, the while we're here, well, I know we're talking about osteoporosis, but something kind of hit me with a couple of patients. They had like a pinched nerve,
Okay.
but they had a pinched nerve in their back, and you can hold your weights because you were giving them something else. The pinched nerve in their back. Most people, when they bend over, they bend over more forward than they do backward. And so what happens is that little soft cushy between the spine, you end up with a bulging disc or a herniated disc because you're always bending over. One of the things that Lamar, Amos, and David is probably going to tell you to do is when you're doing exercise, you're going back that way, all right? You're going back more that way than you are, because most people will do these exercises all day long when they're bending over. You're making your situation worse. That's why I want you to come online, because if you come online for the training, we can help you. But if you're at home and you're just doing exercises and you have herniated disc or bulging disc in the lower back, we'll talk about the neck area later on another live. But right now, I want him to show you something.
Okay. On these routines here, you can just stretch back forward.
Now, you want that disc to slip back in place. You want to avoid surgery. And in order to avoid surgery, you want to go backwards more than you're going forward. So remember what I'm saying to you. Stop bending over with your exercise as much as you do. And they do the same thing as it relates to their stretches. They bend this way when actually when we're on the floor, we're bending a different way. Right? Mm-hmm. So let me just lay on the floor and he'll just bend me a little bit. I'm old, so it'll take time. Mm-hmm. With old people. All right, so you go ahead and I remember I got a bulging disc is basically what we're saying.
Okay. So what I do here is I take each individual leg, right, before bending both legs, just to get a full stretch in both legs so that the muscles are relaxed and that the client himself is relaxed, or she, just to give a full body, lower body stretch, which in turns help.
Because remember, you want that disc to go back in place. You want to avoid surgery and you want to get rid of pain.
Okay.
You're going to feel it in the hamstring too. This is more assisted stretching.
Assisted stretching is needed at this point. So what we're going to do here now, right, is I'm going to take both of his legs and I'm going to stretch him just as I did each individual leg. But at this point, we're going to try to go as far back as we possibly can.
Oh boy, that's going to be PNF stretching. Uh-oh.
Okay?
Don't try this at home alone without somebody being online. You say stretching my back out?
Okay, in this stretch, right, what you get is complete oxygen to all your muscles, from your lower back, your upper back, your hamstrings, your glutes, and your quads. Okay? The goal to this stretch is to be able to touch down above your head. Breathe and relax. Relax. Try not to jerk or jump in any kind of way. Great. Great. And hold 30 seconds. And just relax. Extend your legs a bit more. Great. 10 more seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly come back down. Slowly let your legs down. Slowly.
Ah, you didn't know old man could do that, did you?
Relax your legs. Excuse me. All right, now out of that stretch, right? Right out of that stretch. Let your body lay flat, legs flat. Okay. I'm gonna bend this knee in. Switch sides. Breathe. Now I'm gonna have you to sit straight up for me. Good, and reach out for your toes. You want to try to grab your toes if you possibly can. And push and pull. Pull with this and push your toes out. Nope. Hold them. Hold them in your hand. Now push your toes against my hand.
Got it.
Good. Just like that. That's how you're going to hold it. Push and pull. Great. Now reach for the center of your feet. Last one. Outside. Good. Outside. Knees down. Great.
Little flexibility, still working on it. What I want you to do is call that number 240-383-4800. You got Lamore here, you got Amos here, you got David here, and you have myself here. These guys have great training. They're able to help you. You can go online and get the support you need, whether it's diabetes, whether it's anxiety, whether it's depression. There's exercises for mental health situations. Whether they're suffering with upper back problems, lower back problems, whether it's your leg, whether it's your hips, whether it's anything that's going on in your body, if it's physical or if it's mental, there are exercises, there's food that you need to understand, holistic nutrition, the supplements that you need to take, the exercises that you need to do, and then when you're online, you get immediate feedback. Like he was giving me feedback when I wasn't pressing my toes or pulling my toes, he gave immediate feedback. Did you see that? Immediate feedback. That's what you're going to need online. You need somebody to give you immediate feedback whether you're doing that exercise correctly or not, so that you can get the benefits of the exercise. So, Lamar, what do you think?
Well, I believe that in doing any routines, any exercises, is very important that you're aware of everything that you're doing and that you're doing everything properly. So if you want to get proper training and you want to correct the issues that you're having, because this is a diet time right now, and you don't want to just let your weight catch up with you, and you come back into the office and you have more problems than what you had when you first came into the office. So let's try to keep up, get online, and let's get these exercises going, and let's help make our conditions a lot better that we're now currently dealing with. And due to the COVID-19, let's not allow that to keep us from doing the things that we can do to strengthen our bodies and make our bodies better as well as our health.
Now, if you got any questions, you can or comments, you can give them to us. Don't forget to hit the like button, and don't forget to share at the very same time. Hit the like button and also share. But contact us at 240-383-4800, and we'll set you up with an online practitioner that's going to help you. Again, you got Lamar, you got Amos on the phone, you got David, who isn't here, but he's working with other people right now. But we can definitely accommodate you anywhere. Do not allow yourself to sit in the house and not exercise. And you're going to have some mental health stresses. There's going to be stress, there's going to be anxiety, there's going to be depression. Some people are dealing with bipolar scenarios, and some people are dealing with schizophrenia. Some people are dealing with a whole lot of things that are going on right now. And situations like this will make things that are dormant in you come up. You didn't even know you had it. And you start showing symptoms, and it will come up. Exercise, diet, and talking is going to help you. Exercise, talking, and diet is definitely going to help you in the process. If you don't, what you're going to do is you're going to sit at home and you're going to watch TV. And when you start watching TV, your brain is going to tell you that you need to eat. And you're going to eat, you're going to eat, you're going to eat, you're going to eat, you're going to eat. And
you're going to eat yourself into a depression.
You're going to eat yourself into a depression. You're going to eat yourself into obesity. That's the other thing that you're going to do. You're setting yourself up for defeat. You need an online coach, and these guys are here to be the greatest online coach that you need. Again, that number is 240-383-4800, and it's good. Now, here's the last thing I want to tell you. Because we're in a chiropractic center, basically, a pain center is what we're in. Our gym is open because we have to see patients through the process. We also do post-rehabilitation here in the center. We do clinical exercise physiology, yes, and we do a lot of post-physical therapy work. People have already been in physical therapy and they've got some real problems that are still going on, and so our offices are still open. But we're also a mental health agency, and we're holistic. We stay open. We use exercise and nutrition and supplements to help treat people who have mental health issues, as well as chronic issues, chronic illnesses, and chronic pain. You can have diabetes or you can have hypertension. You are still seeing us because associated with those things is some mental health scenarios. You have the physical health part of it, and so we're there from a holistic perspective to kind of help you. And so our gyms and things are open. Every time we see a patient, everything is wiped down, clean, and before another patient's ever enter into it. Our areas are small, and we do one-on-one. So you don't have 2 or 3 people in one space working. So we have small areas, small area rooms. So a person can be in this room, another person's in another room, and another person's in another room. In Virginia, is 1, 2, 3. There are 3 rooms that we use in Virginia. In Maryland, we have many rooms to be able to use, but there's a gym there, and then we have our offices, and then of course we have other spaces upstairs and downstairs that we're able to use in our Maryland location. But we're open because we're here to help fight people that are
people to fight.
Have people to fight. COVID-19.
As well as your own personal.
As well as your own personal issues. So, again, Amos, what do you feel about that?
Great.
You feel good? Mm-hmm. All right. So again, contact Lamore, contact Amos, contact David. Call the number 240-33-4800. If you have any questions, don't feel ashamed. Contact me. Let's talk about things. We've got psychologists who will come online. We have psychologists who will come online. We have counselors who will come online. And we have coaches who will come online. And we have exercise practitioners who will come online. We're here to kind of serve you. Let us know. All right. See you later.